everyone. This is WCEG Network, Veterans Today, co-host Herman Anderson and Anthony Aiken. We are your community empowerment group. Today, as I said earlier, this is Veterans Today with co-hosts Anthony Aiken and Herman Anderson. We're going to talk about veterans issues today and how to hopefully help you deal with some benefits in navigating the system. There are ways, let me give you the ways that you can join in the conversation today. You can, we are streaming live on Facebook, YouTube, LinkedIn, and you can also watch us by going to WCEG Network. You can also go to WCEGTalkRadio.com, hashtag WCEG Network TV, hashtag WCEG Network, and hashtag WCEG Radio. Those are ways that we would like to have you join the conversation today. We are also on Twitter, live stream on Twitter. And let me give you our disclaimer. The topics and opinion of those of the show hosts and guests are not WCEG Network. They are of the show hosts and guests. We are also a nonprofit, and we would gladly like you donation and contributions. The way to reach the business office is 404-490-8646. And with that, I'll get started. I am Herman Anderson, my co-host, Anthony Aiken.
Hey, Herman, how
Good
you
afternoon, Brother Aiken.
How you doing, Herman, and everybody else out there on listening to WCEG Network? We look forward to every time we're on the air providing accurate, up-to-date, and important information for veterans and their families. So today, like all the others, we're raring to go to provide you some good updates. As Herman said, we're across so many different social media streams. So we hope that you're out there listening, and please share our information with other veterans so they could be empowered with information. And that's the important thing, empowered with good information, Herman. Very important. You know?
Yeah, and there's May is a big month. May is Military Appreciation Month. May is the end of the day is Memorial Day. And also today, I was informed by one of my person that I work with the AARP. May 6th is Military Spouse Month.
Correct.
So we want to say happy military spouses to everyone. And Sunday is Mother's Day, so we will keep that in line as we go through our hour of information. And I think we'll talk about some of the issues that Anthony and myself has been talking about ever since we started this program is benefits, navigating the system, and the top priorities of our veterans as we deal with the Veteran Benefit Administration.
Well, you know, we've both been retired now for so long it's hard to remember. But even with that being the case, there's still some of the same issues that challenge veterans today when they're leaving the military. They were when we retired, for me back in 1999, and for you even further back. And according to some of the national media, taking a look at some of the challenges, number one is still unemployment. Number two, relationships with themselves. 3, homelessness. 4, poor mental health, and under that could be considered depression and suicide. And, you know, as a veteran, there's something that we need to constantly harp on and talk about, that for those that have served our country with duty, honor, integrity, and all the other adjectives you want to put with it, we should not have these high numbers or these high priority issues facing veterans when they get out of the military. To me, it's still crazy that veterans, you know, who've done noble things for their country, come home and they have issues with homelessness, unemployment, and poor mental health.
Well, that is true, and I did some, as we were discussing offline, some research on some of the current items that are like in addition to what you mentioned that are important to veterans today, and it's about benefits. For an example, uh, the veterans that served in Operation Iraq Freedom, uh, they their benefit situation is as difficult as as we're dealing with veteran our age. We're dealing with Agent Orange, and the Operation Iraq Freedom veterans are dealing with their situation. And the system is actually the VA system is being changed in the word that the Veteran Administration saying is being updated, improved, but we're not seeing the improvement at this time.
No, we're not. And when you take a look at it, what's always intriguing to me is to take a look at making sure that the veterans understand the VA is broken down into two lanes, one being the hospital, where you and I go to see our primary care provider, get lab tests done, set appointments, etc. And as you brought up earlier, the benefits and compensation, which deals with the regional offices, but you can't get your rating unless you have an abundance of accurate data coming from the hospital. So it's very, very important for veterans trying to find out what their level of benefits and compensation would be, is to ensure that they have good records. Now, let's say they have not been seen at the VA hospital to accumulate a large number of records seeing VA physicians. Not a problem. Whatever records you have for illnesses that were associated with your military duty, time in service, and even though you may have not been seen by a VA physician, those records are still very good to move forward to see if you're eligible or what level of eligibility you'll have for benefits and compensations. So record keeping is very, very important, and also making sure that you understand the process by utilizing a third-party agency like a veteran service organization that will help you navigate that maze called the VA regional offices for benefits and compensations.
Well, exactly. And just to add to the record process that you mentioned, there and having a VSO, there's in the process of doing that. If a lot of your records are with non-VA providers, the other hospitals, whatever, there's a built-in process in the system.
Sure.
There's a form that you fill out, and it doesn't always work, but it's designed to be kind of straightforward. Is you fill out this form in your records from the non-VA provider will be provided to the VA. But as an individual, it's up on you to make sure that this is taken care of.
Yeah, it's important. I don't know if you saw it or Herman, but I think about a week, maybe a week and a half ago, there was an article that came out that there were like over 800,000 records at one particular VA, and I'm not gonna call the name right now, but one particular VA, 800,000 records that were stored and not worked on or even acted upon by the individuals who are supposed to be helping veterans and their families with getting their benefits and compensations. I got extremely angry because that took me all the way back to San Francisco, to Phoenix, to Baltimore, all those places that had documented cases whereby individuals' records were not seen. In many cases, those veterans died and never had their records reviewed as it should have been. It's appalling.
It really is, and I saw the information also, and it took me back to when we first started
Correct.
this show. As you said, we were talking about San Francisco, Phoenix, Philadelphia, and it's 7 years later, and it's still happening.
Still happening, but yet we still don't have the mechanism or the leadership in place that will go to these hospitals that have very low ratings. And Atlanta VA is one. This is what I'm saying to you is documented, it's all online. In the state of Georgia, we have Dublin, we have Atlanta, and we have Augusta. And you know, the ratings are 1, 2, and 3, with 3 being the highest being 5. But Dublin, Georgia has a 3 rating, which is like middle of the road. Augusta has 2, which means, hey, there's some issues going on here. And Atlanta has a rating of 1, saying the whole system's broken. Now, what's going to be done to correct it? That's what the VA national leadership need to be focusing on, to ensure that these facilities have the correct staff and correct services needed to take care of veterans to improve those ratings.
I agree, and we are, WCEG is nonpartisan, but I think when we're talking about the VA at a national level, the people that we are sending to Washington to represent Georgia, represent all veterans. Election time, we should do our homework and ask those people, what are their priorities for veterans?
That's very true. I just wrote an op-ed this morning to a local mayor, and the op-ed was basically on the fact of voting. The op-ed for this one and for the VA would be making the VA accountable. It's the same principle. People in charge need to be held accountable and understand what's going on in their building, with their staff, with their resources, and everything to make that veteran that walks through that door, male or female, regardless of gender, race, regardless of the service, doesn't matter. What that service member wants is first-class service for
exactly
the duties that they perform for our nation.
In a timely manner.
In a timely manner.
And particularly, like we were talking about, having to wait 5 years if you in the system requesting benefits and you're disabled, and a lot of times veterans are financially in bad financial situation too, and your request is just sitting somewhere. That's not good at all.
That's not good at all. And here you are, veteran Herman, veteran Anthony, who were doing what the VA says to do, get all the documentations together, all the paperwork together, and even working through a veteran service officer organization. And that could be DAV, Veterans of Foreign Wars, Purple Heart, whatever. All these nonprofit veteran service organizations that are not employed by the VA to help you navigate that maze called the VA system. But again, it's going to be cognizant upon ourselves to make sure that we're due diligent. And once we push the button to send something email or send something through the mail or meet with that person carrying a handheld document, it is up to us, the veteran, to follow through. Do not leave that to someone totally to take care of something that you need to do for you and your family.
That is correct. And one thing that we always talk about is to do this, to get started, you need your DD Form 214.
Absolutely. Absolutely. So, Herman, you know how I feel about that. It's actually on my phone. I keep a copy on my cell phone. And I think that's important because we don't know the day or time. We have no idea about the day or time that our maker is going to say, you know, your time's up on, and the physical presence is up on this earth.
Well,
So,
that is correct. And also the third part of VBA is the cemeteries,
correct.
the national cemeteries, and you need that when we have to deal with death of a loved one. They have to deal with you.
Well,
They need that information.
well, you know, one thing that we do in our household, I'm sure you've done in your household, Herman, is to be proactive. Now, some people say, oh, that's morbid. I don't want to think about it, whatever. Hey, it's real. If you served in the military, in which you did, and you were deployed, you didn't know what was going to happen. You know what I mean? So I would not look at it as a form of morbidity. I would look at it as a form of reality. And because once that happens, you close your eyes and you're not able to speak anymore, do you have things in place that your family will be able to react to as a result of your demise? One, the DD Form 214. Two, understanding your burial rights. Three, what other compensations that you will receive from the VA as a result of your death. In addition to the flag, there are other things that you can receive through the VA because of you being a veteran. So it's important for all of our listeners to know that they can easily find out by going on va.gov. Let me repeat that, va.gov. And under va.gov, you'll be able to find a whole lot of information of importance to veterans and their families. Burial being one that you could, download or just open it up and read it and make sure that you develop mental checkpoints or print out some documents that you're going to need in the event the veteran and your family passes on.
Well, that is correct. And the ongoing items that we talk about is number one, even though you have a VSO officer, beginning, because I have a nonprofit and we do service benefits also, is at intake, which is at the beginning of when you apply for your benefits. You need to have a copy of your DD 214, and there are several ways to get it. I mean, if you have it, it will help the system flow better. If you have that information when the service or officers start processing your claim. And to add what you mentioned, Anthony, is everything is done on technology today.
Correct.
So we got to be prepared to deal with it.
Yeah. And we got some veterans that, Herman, you and I were meeting like in their late 70s and early 80s that served in the Korean War and other in Vietnam, and got all these health issues that were service connected, but yet because of not knowing or understanding that they are eligible for benefits and compensation, not only for themselves, but their families, have done nothing. Have done absolutely nothing. And to me, it's extremely surprising, but yet real. So anytime I meet a veteran like that, I take it upon myself to educate. Now, I can't motivate you. I can educate you. That motivation is going to have to come from you to say, you know what? You're right. I am missing out on these things. So as a result, I need to get stepping to find the right service organization that fits for me, which one that is, to help me navigate what I need to do.
And just for an example, on the DD Form 214, regardless of what state you live in, all states have a Department of Veteran Services. In Georgia, it's the Georgia Department of Veteran Service, and they have offices, I think 13 offices in Metro Atlanta and offices throughout the state. But the one number that you can call in Georgia is the one at the Capitol That number is 404-656-5940. Again, Georgia Department of Veteran Services, 404-656-5940. And if you're unable to get what you need there, the National Archives number is available also. And it's not an 800 number. The number is 314-801-0800. Again, 314-801-0800. And as Anthony stated, is va.gov. If you go in there, you can request all of these documents through there.
Sure. Yeah, you know, just give an example in regards to burial. When my mother-in-law passed, her husband had already been buried at Arlington. But because of the backlog, and this is all pre-pandemic, but because of the backlog, it took my wife 7 months to get the paperwork all aligned and a date for us to meet in Arlington to lay her mother to rest. And I tell you, the time frame is getting longer. Why? Because a lot of these VA-related organizations are lacking personnel. They don't have enough hires to fill positions, to the point that some services are being curtailed or moved out or marketed out outside the building. So, you know, remember about 4 years ago, we had the choice program and all the issues with the choice program. I'm not even sure if the choice program is still active, but if you need to be referred, you're going to have to ask for a referral so you can go out and see someone on the economy, as we say, the civilian economy, to get the services you need, but yet get a copy of what was done so you can hand carry it over to your VSO to help you with your processing of paperwork for benefits and compensation.
Yeah, the choice program has been renamed to something else, and it's the feedback that I can get, and the replacement is not as didn't work as well as the choice. There's still issues with the doctors getting paid, and some of the same issue that you address is the time that it takes for this system to work. And you know, some of it is blamed on COVID-19, but
yeah. And that's true.
goes on.
I mean, you and I, and we travel around the country, we travel around the city, and we see a lot of places that are begging for employees. I saw one not long ago that was talking about, getting people large numbers, dollar numbers, to come to work. You know, come to work. So it's just amazing to me. You know, just amazing.
It is, and just I did some research this morning, and it happened to look at one that says, "Am I eligible for VA survivor's pension and survivor as a spouse?" And there are 3 bullets that I'm going to give to our listeners.
Okay.
Number 1, the veteran entered active duty. This is to see if you qualify. The veteran entered active duty on or before September 7, 1980, served at least 90 days on active service with at least 1 day during covered wartime period, or the veteran entered active duty September 7, 1980, and served at least 24 months of full period for which they were called ordered into active duty. And the third one is the veteran was an officer and started on active duty after October 16, 1981, and had previously served on active duty for at least 24 months. Those are basically ways to verify as a spouse that you qualify. for survivors benefits. And just to add to that, in in the last 6 months, I've had 3 veterans pass away, and when that happened, that's in my organization. They were a member of my organization, which is Veterans Helping Veterans. And when that happens, there's a process that you need a VSO to help. The surviving spouse need a VSO to help you with this, because you have to have, like Anthony said, the death certificate, documentation. Then you can file for the spousal benefit.
Correct.
And no, I'm just letting our audience know that.
Yeah, it's very important that you understand the rules of engagement and recall, there's this book out that I keep posted on my desk all the time, Understanding Your Federal, Benefits. This little book right here, you recall, Herman, they used to have hundreds of these throughout the VA system, and because of cost cuts and backs and all that, they now put out this pamphlet. But this pamphlet still has quite a bit of information. I keep it handy all the time because, just like you, I receive calls from veterans or inquiries from veterans asking for support. I got one this morning. I haven't even met the gentleman yet, but he wanted to have some conversation in regards to the process. So again, I'm going to listen to his story, understand what he's trying to do, and then lead him down and for him to take a look at the Federal Benefit Guideline book that is published by the VA, and making sure that he has his documentations together, ready to move forward with a veteran service organization or officer to assist him in that process.
And one thing that pamphlet does is, it all points back to, it gives you a lot, instead of like the book that giving you all the details, it gives you the headline and it refers you to go to a website.
Correct.
So that's back to the technology issue.
Yeah. Now I know we have veterans that are not computer literate, are afraid of the computer or whatever. That's why it's important that they have someone like a veteran service organization or person to help them with that maze. Now they can have, niece, nephews, sisters, brothers, somebody else that could help them. But again, that motivation is going to come from that veteran to get the process started. And once that process is started, to follow the steps necessary. I was speaking with one VSO earlier this week, and he indicated that the stream, like you said at the early part of the show, that the streamline process for getting your paperwork done is not as streamlined as you think. And it's really prolonged because of lack of staff, stuff being hidden, 800,000 records not even being looked at, just stored, and veterans are waiting and waiting and waiting. Recall, Herman, you and I, it took us 2 years to get a response on an aid in attendance.
Exactly.
2 years. And then after 2 years, it was denied. After 2 years.
Yes.
So now, you're going to have to start, about to start the process again to see what goes down, because my queen, my spouse, deserves the support for what she does for me. I couldn't do a lot of things without her support. I'll be the first one to say that. And I want to make sure that whatever is legally authorized for her, she receives it. I think that's important.
I feel the same way. And also aid, and that's one of the benefits that the VA is one, in certain situations, you kind of have to go look, and they don't put it out there so you can see it. And a lot of people that I talk to and deal with, they're not even in, and they are Vietnam veterans, World War, Korea veterans. They're not really aware that that benefit is available. I had an example last month where this this a lady got it for her father, who was a Vietnam veteran, and I made her aware of it, and she ended up getting the full amount for until he passed away. And that was because I made her aware of it. She wasn't. It was his daughter that was the caretaker. She
No,
wasn't even aware that that benefit was available.
right. You know, and it's too now. I must admit, there are a lot of veterans that, for whatever reason, you know, not follow through, but yet they don't inform the family because either they don't know or they haven't, you know, done the research enough to find out the answers or get in touch with people that can help them. I know my wife and I have been discussing, you know, redoing the aid and attendance, and I'm taking a look at the documentation now for the paperwork that we filled out, which was a VA form 21-0958. And this is the form that was used to initiate the aid and attendance through my CPC, my PCP, primary care provider. And I strongly deny, I mean, not deny, but strongly, you know, disapprove the VA's rating, and I'm going to start it again. Because I know, being a 100% service-connected individual with the level of difficult vision issues I have and my level of compensation, that we should have a favorable result for this aid and attendance and not a denial after 2 years of waiting.
Well, it also service officers in any profession you're in, there are people that have their specialty. They're better at certain things than they are at others. And I just within the last 3 months, I've met a service officer that that's his specialty, and he's the one that's been getting good results. So
exactly right. That's exactly right. Because they understand.
I just want to let our listeners know that and we'll take a quick break. We are at the halfway mark, and we want to let our listeners know this is WCEG Network. We are the Worldwide Community Empowerment Group. We are live stream on a lot of platforms, YouTube, Facebook, LinkedIn. You can also listen at WCEGradio.com, WCEG Talk Radio. Keep listening and give us feedback on Facebook and on our other platforms. And at this time, we'll move on, Anthony.
Well, you know what? Herman, you and I are about to come up on 7 years of doing this. I can recall the first show how you and I were just petrified. You know, we're about to put ourselves out there to talk to the world. There was something new and innovative. Well, since then, we have really grown into it and become a solid team in regards to putting out information that would help veterans that face challenges when they leave the military and help their families. And the feedback that we've gotten back from a lot of our listeners from around the world, it's been very, very formative. I mean, very, very favorable. And I still get cringes in my system when I think about certain veterans that responded to us, like Larry X, about 4 years ago, when we had the big show on Agent Orange, and him being a Vietnam 11 Bravo on the ground grunt was all up in Agent Orange. But for all those years after he retired, he never, and all the illnesses that he had associated with serving in the military, he had no idea that Agent Orange was one of them that caused a number of illnesses as a result of being exposed to that pesticide. So it's amazing to me that today that still exists.
Well,
People are not informed and know about company.
I would call that situation and some other situations in different organizations when I'm speaking to veterans. I tell it from time to time is, when we started and we communicated with some veterans that they had been trying for 18 to 20 years, or they tried for a while and they just stopped. And when we started Veterans Today and started talking about it, like you mentioned Larry X, they picked it back up again.
Yeah. I'm sorry.
They started back and got great results, and that's what we all about.
It's important that we as veterans continue to push forward and let folks know that they're not alone, that they can get things done. Just follow the rules of engagement. That's my favorite words from the military. Understanding the rules of engagement, they get stuff done. Simple as that. You got to follow the plan. Otherwise, you're going to be out of luck getting it done. That's just real world, That's real world.
And one thing that we usually do is give out some of the crisis information numbers, and that's important, particularly on a few of them. So I'm going to give out the suicide prevention and crisis number, and the suicide prevention number is 1-800-273-82655, 1-800-273-8255. And I believe that the plan in the system in the VA to roll out a 4-digit number similar to, I believe it's going to be, 988. It's supposed to be rolled out, I believe, next month. But now that's the crisis line, and the suicide prevention line is the same number.
Correct.
And the National Domestic Violence Hotline is 1-800-799-7233. 1-800-799-7233. And the homeless veteran hotline is 1-877-424-3838. 1-877-424-3838.
Good information, Herman. We said at the top of the show that May is National Military Appreciation Month. And this is an opportunity that came about when Congress designated May as National Military Appreciation Month in 1999 to ensure that this country, this nation, was given the chance to publicly show their appreciation for troops, past and present. I would not say the word troops, I would just say service people or servicemen, past and present. That includes females and males. But there's so many things that are going on. Not only that we have to pause for Memorial Day that's coming up, but also, some of the things that we need to talk about, like for instance, today being a National Spouse Day for the military. But later on in the month, there'll be several other things that are going on. We hope that some of the veteran ministries at the churches are, round up and rallied up to put out some type of support for the veteran. I know during the 6 years when I was the president of Ben Hill United Methodist Church Veterans Ministry. Every May, we look forward to it because it's an opportunity for us to really show our appreciation for those that serve. So listeners out there, National Military Appreciation Month, May 2022. Let the veterans know that you appreciate them for all of the sacrifices they made for us during their time in the military.
And just to, actually, I have a one paragraph definition of Memorial Day.
Oh, yeah.
Memorial Day is dedicated to honor and remember the men and women who died while serving in the U.S. military. Although it is observed on the last Monday of May, carried May long the, okay, that's basically the definition. There's some additional stuff that's written, but that's the definition of Memorial Day and the purpose that it was started.
Well, you know, it's a date where we consider memories for the lives that served in the United States Armed Forces. And, you know, we have to make sure that everyone knows about this date. And there are all kinds of celebrations that go around, you know, a country during that particular time. There are parades, there are declarations, there are services, memorial services, all kinds of things that are going on. So it's important for you to know the importance of it and to honor those that, you know, what Memorial Day is all about and how can they, you know, support veterans and do what you can to learn about it and to honor those that serve. That's important.
That is important. And we still know we got to take care of Agent Orange guys, Vietnam veterans, Korean veterans. There's still, as you mentioned earlier, veterans that not aware that they for benefit.
Lots of.
The register Agent Orange register, which is a starting point if you are not in the system. The number to call is 877-222-8387. Again, that's 877-222-8387. And if someone is listening and there are at least 14, I think it's up to 17 ailments that are associated with being exposed to Agent Orange.
Yeah.
So as Anthony said, there's a lot of us veterans out there that were exposed to Agent Orange, and we are suffering from some of these ailments and not being compensated for it.
Yeah, just think about the number of soldiers with boots on the ground. And as a matter of fact, this is a very good example. A veteran out of Arkansas contacted me not long ago, and he served in Vietnam. And I wanted a copy of his DD Form 214, which he sent to me. He served 6 years in the military, and it showed on his DD Form 214 all of the medals that he received during his time. Several of them had ribbons and awards associated with his service in Vietnam. But what was surprising to me is that they did not list any of the units that he may have served with. So the first thing I told him he needed to do was to have that DD Form 214 updated to reflect it. So when he did go to the VA to file for Agent Orange, there would not be any question in regards to what's on that DD Form 214, which in my view was outdated because it didn't have a true reflection of his time in the military.
That happens to some veterans. I've had that happen also, and it's kind of confusing. Why would our Veteran Administration publish DD Form 214 like that to veterans? But it happens.
Right, it happens. And again, if you don't know to understand the rules of engagement, when you take a look at your DD Form 214 and you review it, And there's certain blocks that you're going to take a look at. Okay, awards, good. Assignments, good. And if those two marry up, and it shows that you had boots on the ground. And recall, if we go back to that show 4 years ago, we provided a map to our listeners that out of the 4 corps, 1 through 4 corps in Vietnam, if you were in either one of those corps during that particular time, you were in Vietnam and you served during a time when Agent Orange was being utilized. In addition to that, if you served in the Philippines or you were in a Navy ship they call gray water or blue water, any of those kinds of things, and you were exposed to Agent Orange, you were still able to apply for benefits and compensation based on those exposures. So that map clearly indicated where the units were located at the 4 corps. And if you were in one of those corps, then you are eligible to go to the VA to get yourself into the VA Agent Orange database to get that process started.
Well, that is correct. And what you just emphasized is what we do here on Veterans Today, is empower the community and make our Vietnam veterans and Korean veterans aware of this information. Because you stated earlier, there's a lot of our veterans that not aware of the opportunity or the benefits.
Don't have a clue. And please, veterans, please stop the thought pattern of, look, if I get these compensations, it may block somebody else from getting compensation. What? That person served just like you, and you have just as much rights and privileges as that individual. So please do not think that you're applying for your compensations and benefits, that you're infringing on someone else doing the same thing.
And there's some people think that along those lines that we are asking for benefits that as donation. Those are benefits that we earn. It's not anybody is giving us anything.
You earned every bit of it by putting those boots on. A lug in a rucksack. You know, I don't care if you're in a helicopter or on a ship, in the Coast Guard, Marines, Army, Navy, Air Force, doesn't matter, you served. So you served with honor, you received an honorable discharge, and if you were exposed, then you should be compensated. What I'm finding out too, though, a lot of veterans, and I'm so glad this older veteran told me when I was a young captain. He said, look, if you're injured, I don't care what it is, get it documented because it occurred while you're on active duty. So when the time you retire and they go back and take a look at your medical records 15 years ago for something that you're claiming now, there is documentation in your records. Now, even after you've retired and you're coming down with these illnesses, and let's say you did not see a PCP provider, you still may be eligible based on the examination of that primary care physician you're being seen with. And when you first started revealing that you were having symptoms related to that exposure. So the key factor is to make sure that everything you do is documented. So when you do apply, you have some type of a track record or trail based on the illnesses that you're claiming.
Well, that is golden, because during our era, most veteran was told not to go to the hospital. Correct. I mean, the culture was if you get injured, you just push through it.
Well, yeah.
When you do that, there's no documentation, there's no record. Yeah. And the key thing in when you file a claim, is it service connected?
Is it service connected? Man, I tell you what, those 2 words, service-connected, could change your entire life in regards to support from the VA. If you are 100% service-connected veteran, woo, I'm telling you, and if you follow through the way the system is designed to follow through, that you being due diligent and not taking no for an answer, and not following through to the nth degree, you're missing out on a lot of things for you and your family. From education benefits to vehicle benefit, you name it, you're missing out.
Along those lines, another item that I researched came across this morning is for our military people now that are active, and it is, can I file a claim for disability before I'm discharged? And here are a few bulletins that say you can. You're a full-time member on full-time active duty, including a member of the National Guard, Reserve, or Coast Guard. You have a known separation date in the next 180 to 90 days. You are available to go to VA for exams 45 days before you are submitted. You can provide a copy of your service treatment records for your current period of service when you file your claim. So to our active military people that has a disability and you getting ready to get separate from the service, I recommend that you file a claim during your transition period.
Yeah, during your transition period, as soon as possible. I know that we all went through the transitional exit briefing from the military, and I can recall it like it was yesterday, leaving Walter Reed. And by the way, I was just in Washington last week, and I went by, a little side note, Walter Reed, which at one time was the largest Army medical facility in the country. It has completely been razed, torn down, and all of Walter Reed now is being re-gentrified for other federal related services and condos, and it's going to be like a work, play, live environment. So what they called years ago, when the military installations were closing down, Walter Reed was one of them, but it's being regentrified for the people in that community to still receive some type of accommodations, not military related, but accommodations from housing and other type of federal agencies.
So in the Washington area now, isn't that facility still named Walter Reed?
Right, it's the new Walter Reed, which is in Bethesda, right across from the National Institute of Health, NIH. And it is actually now controlled by the US Navy, but they have Army and Air Force and Coast Guard contingencies there. So you could go over there to be treated and served. It's a much newer facility, well, just an updated facility as a result of the BRAC closing down of the old Walter Reed, but individuals can go over there and receive adequate medical care.
Okay. So we winding down. We got about 8 minutes left. So we're gonna continue this. One other benefits that's available is the housing grant program.
Oh yeah, yeah.
And that's part of the claim process also.
Correct. Matter of fact, our veterans and listeners need to know that there are two sets of money, pots of monies that a service-connected individual or veteran who's qualified can go and receive. One being the HISA, and that's a housing grant that is authorized through the prosthetics department at the hospital, and that fund is up to about $7,000. I think it's $6,880 something that a veteran could utilize for prosthetics or things to help them in their home setting. The other one is called the SHA grant, and that's a larger pot of money that a veteran could go after, up to $100,000 to do modifications in your home. But that money comes through the regional office. SHA grant that you could go and read up on. Again, go to va.gov and type in SAH grant, and then also HISA, HISSA, and look at those particular programs to see what you're eligible for.
Great. And I'm going to give out some of our numbers again. National Suicide and Veteran Crisis number is 1-800-273-8255. The Domestic Violence Hotline is 1-800-799-7233. And the homeless hotline is 1-877-424-3838. And there's a number that I had some questions from people that were dealing with financial situations. And there's a 800 number for debt management. If you dealing with financial situation, medical or housing, and that number is 1-800-827-0648. And it's the Debt Management Center. Again, it's 1-800-827-0648.
Okay. I just want to make sure that, I got to remember, I am out of the military now with all these acronyms. We got to let our people know that SHA stands for Special Adaptive Housing, SAH process. You can go online to va.gov, read up on it. And for instance, I'm legally blind by the VA, so I'm eligible for that. If you're a veteran that has some other type of disability, it could be amputation or whatever it is, you're also eligible. But you need to go through and initiate the process. There's a certain form that you fill out, all that's online, and let them start the process for you so you can receive the compensation that you've earned.
Well, from what I've understand, if you, for example, if you need something done to your stairwells or walk-in shower, modification to your house, that's in that system also.
Yes, there are a lot of things listed that you could utilize the funding for. The process is to the point now that the VA doesn't really help you make a selection on who your particular vendor is going to be to do the work at your home. What they want to make sure is that you have the funding necessary based on, you going through that qualification process. And once approved, the fund will be deposited into whatever account you want them to deposit in, and then you can go on and do it. Now, the reason I'm saying that, because I'm going through that process right now. We've done a lot of things at our home, and we're still doing things at our home based on funding received from the VA, because we went through that process. It took about 3 months, but that was okay. We had good open communications. It was just a matter of, as a result of the pandemic, things slowed down, but they were still moving forward. And with the due diligence of staying with, it was important. Herman, I always got to say this. I understand this is going to be our last show for a minute until September.
And we got one more.
One more.
Go ahead.
But we need to make sure that we give a shout out to our leadership team, that being Ms. Rogers, who started this vision, that mustard seed, as we call it, back in 7 years ago. And the WCEG Network now, that brings life into the community, has so many different shows. So I know, Herman, you and I are handsome young guys, but there's some more beautiful people on WCEG Network that they can listen to every day. Issues and answers and interviews with, government people and all those kinds of things. So please check out the WCEG Network, WCEGtalkradio.com, and be informed, because we do speak life into the community.
And before we close, we had one other. What is SHA grant?
That's Special Adaptive Housing.
Housing, okay.
Special Adaptive Housing. And that can be found on va.gov. And they'll also find information in regards to the other type of funding that you can receive from the medical side of the house, medical side for funding to help in your home.
All right, we're out of time, and we will be back on May the 20th with our guest, Valencia.
That's right. One more show. Valencia, I
We'll be
apologize.
back. This is May 8th, Sunday is Mother's Day. So we wish all the mothers happy Mother's Day and safe Mother's Day. And Veterans Day is ending until
Herman,
May
as
20th.
usual, it's great to see you. Great to be with you. I know our leadership team is trying to get us back into a studio, but you know, the Zoom has worked very well. We've had some unbelievable guests, and it's my honor to salute you and serving with you in this format.
Well, thank you. I appreciate it. It's both our passion, so we're doing what we want to do.
Appreciate you, man. See you on the 20th, Herman.
Thank you.
Take care. Bye-bye.